Hi, my name is Lauren. I'm a freshman in the School of Nursing at the University of Michigan. Today I'm going to be presenting one of my patients from my clinical placement at Glacier Hills Rehabilitation Center. My patient is a 77-year-old Caucasian female. She is a retired art teacher. Her usual source of medical care is St. Joseph Mercy Health System. Reason for seeking care. Patient is currently at Glacier Hills recovering from pneumonia after difficulty breathing during examination. History of present illness. Patient was admitted February 15, 2014. At the time of interview, patient had been there for about a month and was nearing the end of her stay, expecting to be discharged within the next 2 days. Patient originally went to St. Joseph Mercy Hospital and from there was admitted to Glacier Hills Rehabilitation Center. Patient reports being healthy prior to pneumonia, but charts indicate medication for hypertension, cholesterol, and bipolar disorder. At the time of interview, patient reported little discomfort from the pneumonia. Vitals. I did not get a chance to take vitals, but if I had, I would have expected all to be within a normal range. Respiratory rate, 12 to 20 breaths per minute. Blood pressure around 120/80. Pulse within 60 to 100 beats per minute. Temperature would have been about 96.9 to 98.3 degrees Fahrenheit. Patient rated pain 2 out of 10. Health history. Past medical history includes an appendectomy and a right knee replacement. Patient is up to date on all immunizations and has no known drug allergies. Patient's health habits include exercising regularly, sleeping about 9 hours every night, and eating 3 relatively healthy meals per day. Patient only drinks alcohol occasionally and declines using drugs. Patient was recently widowed and has 2 sons, 1 living and 1 deceased. Patient is Lutheran and attends church regularly. Patient will be moving to Chicago to live with her son and his family after discharge. Pharmacological interventions. For this patient, pharmacological interventions include 4 mg of Lipitor taken orally daily, 500 mg of calcium taken orally daily, 200 mg of vitamin D taken orally daily, 500 mg of Depakote taken orally daily, 100 mg of Colace taken orally daily, 10 mg of lisinopril taken orally daily, 10 mg of Aricept taken orally daily, 650 mg of Tylenol taken orally 4 times per day, 60 mg of Evista taken orally daily, 25 mg of Toprol XL taken orally daily as needed, and 100 mg of benzonatate taken orally every 4 hours as needed. Review of systems. The 2 systems reviewed were the lungs and thorax and the neurological status. Pneumonia had affected her respiratory system and a neurological assessment because patient is elderly and seemed to be slightly confused. Patient reported no shortness of breath, bronchitis, or asthma. Patient has no coughing or sputum and has no history of respiratory infections. Patient reported no pain or wheezing with her breathing. When asked about breast exams, patient admitted to not doing them as recommended. However, patient does get a mammogram every year. The only finding from this review of systems was the patient's pneumonia, which was the reason for stay at Glacier Hills. That at the time of our conversation, patient was in the later stages and had no significant breathing problems. For patient's neurological assessment, she reported no numbness, tingling, or burning. Patient does not have seizures or lose consciousness. Insomnia and anxiety are not problems for her, and patient has no difficulties with speech and no past history of a head injury. My only finding from this review of system was that the patient reported being unsteady when balancing and walking, but I did not see this as a concern due to patient's age. Physical assessments. I conducted a respiratory assessment and a neurological assessment. The respiratory assessment consisted of inspection, palpation, and auscultation. Patient's thorax was appropriate in diameter and symmetry, and had no injuries. Patient's breathing pattern was normal in depth, distress, and rate. Patient's trachea is symmetrical. Expansion was also symmetrical. Patient has no sign of tactile fremitus, and her ribs and thorax posteriorly showed no signs of pain. Lung sounds were normal anteriorly and laterally, but wheezing was present posteriorly. The egophony showed evidence of slight consolidation in the lungs. Patient lung sounds were expected, considering that she is recovering from pneumonia and is going to be discharged soon. For the neurological assessment, patient started with a mini mental status exam in which she scored a 29 out of 30, indicating intact mental function. I was not able to assess patient's general motor function by a normal gait and a heel-to-toe walk because patient is fatigued from the respiratory exam. For the same reason, I was not able to perform a Romberg test. Patient's upper and lower extremity fine motor function are intact. Patient was able to detect light touch and pass stereogenosis, graphisia, and proprioception tests, indicating intact sensory function. Patient's Babinski and ankle clonus tests were negative. Patient appears well-groomed and stated age. Pertinent systems. Two pertinent systems that would be important to my patient would be cardiac and musculoskeletal. Patient reported no heart problems at the time of interview, but after looking at the chart, I noticed that the patient was taking lisinopril, which controls high blood pressure. According to a 2005 article from the Journal of the American Medical Association, the largest number of major cardiovascular events, major coronary heart disease events, and hospitalized congestive heart failure happened between the ages of 60 and 79 years of age. At 77 years old, my patient falls in this group. Patient's blood pressure is controlled by medications, but a cardiac assessment would be appropriate because hypertension puts people at an increased risk for the previously stated heart problems. I would also perform a musculoskeletal assessment because at 77 years of age, my patient is part of the elderly population. According to an article in the American Journal of Clinical Nutrition from 2005, muscle undergoes structural and functional changes during aging. The structural changes cause muscle weakness due to a decline in muscle protein synthesis. In general, humans slow down with age and have decreased activity levels. Even though my patient exercises regularly, the patient has and will experience a decrease in muscle function. A musculoskeletal assessment would be necessary to evaluate how much the patient's muscles have aged and what their current level of functionality is.